Hello everyone, Timolabed is my name and welcome to my channel. Let's talk about childbirth. It can be a very amazing experience, but also be quite challenging, not just for the mother and for the baby, but as well as the midwife. While we always focus on the experience of the mother, it is very important that we focus also on the significance of the stress factors that both the midwife and the baby go through. We don't want to underestimate the challenges that come with labor during childbirth. Like I said initially, not just for the mother, as well as for the midwife and the baby. As for the midwives, it demands an unwavering focus, emotional resilience, as well as intensive critical thinking skills. Now, of course, you're going to ask me, how does that really matter? Is the woman giving birth? Well, the person who is staying by the woman's side plays a very, very vital role. Having an understanding between stressing babies and midwives allows us to support both parties during this transformative experience. By recognizing all the factors that contribute to stress and implementing very effective mechanisms, we all can strive for a more calmer and positive birth for everyone. Today I'm going to delve into the reasons of stress during labor, how we can cope with it, and outline very strategic management for its purpose. During labor, babies experience stress primarily due to the contractions of the environment that they call home, and of course the unfamiliar sensations of the birth canal. This stress therefore triggers the release of hormones such as the adrenaline and the cortisol. Now, while these hormones prepare the child for the outside world, excess of it could be quite detrimental, potentially leading to fetal distress and other sorts of complications. On the other hand, you have the midwife, who faces a different kind of stress. Regardless whether you're a traditional or a medical midwife, our role requires constant vigilance. We're required to monitor the mother and the baby's well-being. Now, whether we like it or not, we're there to also anticipate potential problems and make any sort of decision necessary. Our duties require very long hours. We're not able to predict the situation, and we are quite pushed on a tight corner emotionally. Oh, there are other things that also affect the stress levels of the newborn, such as prolonged labor, excessive examination during the labor, as well as maybe the use of forceps. Just saying. Oh, lest I forget, additionally, the stress level of the mother can be transferred through the mother to the baby as well. This happens mostly when you hear women are going to go for C-section and immediately the baby starts stressing a lot. Well, what does that tell us? The mother is being stressed because she's going for C-section and the baby automatically picks it up. Do you want to know how? Because they are both one. Now, why is this important? Mothers have come to me complaining about a certain midwife, birth keepers or doulas, but I want you to take the time to reflect on the role that they played, the decision they make, and why they did it. Stress such as these are often unattended, and this leads to a whole mental torture and the well-being of a midwife being distorted. So this in turn is definitely going to affect the quality of care that a midwife will provide at a given time. Many midwives experience burnout, fatigue, and medical errors cannot even be eradicated from the situation such as this. How can this be handled? We have to recognize that midwives are only just humans like anyone else. Now, if there's one thing I can recommend for midwives, would be mindfulness and meditation, concentrating on a simple thing as your breath. Okay, there are some calm strategies that can be used for stress reduction, but for midwives, mothers, and of course, babies. As for the babies, a very calm light, minimizing the noise can reduce the stress overload for them. And oh, not to forget the gentle touches and massage. Babies love them. Oh, and not to forget to relax the muscles once you feel tensed. For the mothers, another thing which will be more or less in a pair group with all the midwives to talk about strategies that they use to manage stress. This is quite unique because then you get idea of how the other person does it that you don't do it. Mothers, you want to support their emotional well-being. This is where the partners as well as assistant comes in play. That's what I like to call the doulas. Not all the time though. And do not forget, we have to provide a very clear communication and pain relief options for the woman at this time. Now that is when you're in the hospital. Otherwise, when you're at home, the best and only option would be the water birth. Adequate staffing is not to be underestimated, as well as, interval short breaks. Support is highly recommended at this time for both the midwife and the baby. So the midwife, after the birth, she'll have some time to take for herself, as well as somebody being there to assist the mothers with the newborn. Again, this is where assistants will fall in place, like doulas, like auxiliary nurses in the labor ward. And if you're birthing at home, then that's what family members will come in. My name is Timothy, and if you like this video, it resonates with you, make sure to tap on the follow button and do not forget to click on my YouTube channel to get the complete video. See you guys soon.